Healthcare is a crucial pillar of well-being, but what happens when access is limited? Project 2025 proposes sweeping changes to Medicaid and Medicare, which could have serious consequences for Black communities across the United States. Let's take a closer look at these proposals and what they could mean for the people most affected. Project 2025 aims to reform healthcare by reducing federal oversight and shifting responsibilities to states. It focuses on restructuring Medicaid through block grants and shifting Medicare beneficiaries into private plans like Medicare Advantage. But how could these changes impact Black Americans, who already face significant disparities in healthcare? Medicaid is a lifeline for many low-income families, including around 19% of Black Americans. Project 2025 proposes changing Medicaid to a block grant system, which would give states a fixed amount of funding instead of covering a percentage of costs. Critics argue this could force states to reduce benefits or cut eligibility when funds run low. For Black communities in states with already limited Medicaid programs, this could mean less access to health care and a higher rate of uninsured people. And with the addition of work requirements and lifetime caps, many could lose coverage altogether. Project 2025 aims to shift more seniors into Medicare Advantage, a private plan option. This could mean higher out-of-pocket costs and more restrictions on which doctors and hospitals patients can use. For Black seniors, who often have fewer savings and wealth, these changes could pose a serious financial burden. One of the most concerning impacts could be on maternal and infant health. Black women already face maternal mortality rates 2 to 3 times higher than white women. Medicaid covers around 65% of births among Black women. If Medicaid access is reduced, it could make it even harder for these mothers to get prenatal and postpartum care, worsening already dangerous disparities. With less federal support for Medicaid and more reliance on private plans like Medicare Advantage, the burden of healthcare costs could fall more heavily on families. For many Black households, this could mean having to choose between paying for medication or covering everyday expenses. The potential repeal of Medicare's drug price negotiation program could also increase prescription costs for seniors. Black Americans are more likely to suffer from chronic illnesses like diabetes, hypertension, and heart disease. With reduced access to Medicaid, managing these conditions could become even harder. Without consistent medical care, many could face higher rates of emergency room visits and complications, putting more strain on their health and finances. These proposed changes could lead to a widening gap in healthcare access between Black Americans and other groups, making it harder to achieve health equity. While Project 2025 aims to reduce federal spending, its impact on vulnerable communities could be profound, leaving many without the care they need. If this video helped you understand what's at stake, please like, share, and subscribe to spread awareness about Project 2025's potential impact on healthcare. Together, we can make a difference.